Greetings from Rotrak Singhania. Today, we'll be talking about eating disorders. What exactly are eating disorders and why is it necessary to spread awareness regarding eating disorders? What comes to mind when you think of eating disorders is either anorexia or binge eating, and the narrative that comes to mind is not eating enough, which is incomplete and wrong, respectively. To get educated about these topics, today we have Ritika Shetty and Purvi Chandra. They are the co founders of the organization SocioClick. SocioClick is a community org aiming to raise and amplify their voice, break stereotypes, and educate people on various topics which may or may not be discussed often. I'm very curious to know what exactly is the meaning of SocioClick.
Okay, so it is a community organization that works towards educating people about important topics which are not discussed enough and to remove the narrow minded thoughts of people by forming an open minded clique.
Yeah, so our organization helps to amplify and empower voices which are often unheard while fighting against the stigma surrounding it. So we provide opportunities to expand knowledge and gain exposure to the world within all sectors of the society through enacting social impact in and around our community.
I'd like to ask you all what causes an eating disorder.
So in India, people with severe mental illnesses often turn to temples and shrines, not to doctors. So some social workers are trying to change this by focusing their efforts on India's schools. Often, eating disorders are associated as a misconception with the live to eat kind of mentality, but that isn't the case at all. It's just a difference of eating habits that has been inculcated by the body of a particular person. It can be caused by some genetic changes, stress or distressing thoughts, or insecurity. Some genes identified in the contribution to eating disorders have been shown to be associated with specific personality traits such as obsessive thinking, perfectionism, high levels of sensitivity, and rigidity.
And over to causes, although there aren't any exact reasons for any of the disorders. So the roots could possibly lie in genetics and biology. So certain people may have the genes that, increase their risk of developing an eating disorder. And people with eating disorders may also have psychological and emotional problems that would contribute to the disorder. So they might be struggling with low self-esteem, perfectionism, impulsive behavior, and troubled relationships.
Wow, that was new. What is the difference between anorexia nervosa and anorexia bulimia, since we are around the topic of eating disorders?
Okay, anorexia nervosa and bulimia nervosa are two different eating disorders. They can have similar symptoms such as distorted body image. However, they are characterized by different food-related behaviors. For example, people who have anorexia severely reduce their food intake to lose weight, while people who have bulimia eat an excessive amount of food in a very short period of time, then purge or use other unhealthy methods to prevent weight gain.
So anorexia is usually characterized by a distorted body image with an unwarranted fear of being overweight and adopting unhealthy eating habits. So the symptoms may include trying to maintain a below normal weight through starvation. And no matter how much weight is lost, an anorexic person continues to fear weight gain. And on the other hand, bulimia is potentially a life-threatening eating disorder. So people with this condition binge eat with a loss of control due to stressful situations, and then they take steps to avoid weight gain, which would most commonly be self-induced vomiting, which is extremely harmful for the body, but it could also mean excessive exercising or fasting.
Oh, okay. So I wanted to ask, can a person have multiple eating disorders at once?
So yes, it also depends on the kind of eating disorder they're going through. So a person shouldn't really have to go through anorexia nervosa and binge eating disorder at the same time, because those two eating disorders contradict each other. But that means they would be going through bulimia nervosa, which means they constantly binge eat and then later regret it and then force themselves to starve.
Okay. Could you be born with an eating disorder?
It is a possibility. So looking back, if you're paying attention to the causes mentioned, we said genetics could also be one of the main components. So it's theorized that there can be a genetic component to eating disorders, but it wouldn't cause the disorder. It could only increase the risk of developing one. So eating disorders are caused by a combination of genetic, environmental, and psychological factors.
So if there's a mental health history in the family or some kind of a gene for an eating disorder a person is born with, then the risk does have the edge. Even though nowadays people having these disorders when going therapy are found to have underlying issues such as child trauma, body dysmorphia, teenage inferiority complex, or peer pressure, or just a good old fashioned aunties sexualizing girls on their clothes. Mental health conditions such as anxiety, depression, aggression, or addiction could also be a cause. So, if you're unsure about it, then it's better if you go see a professional.
Okay, great. How can I personally help and support someone who is diagnosed with an eating disorder?
So the very first thing you need to know is that your help and support would make the recovery a smooth one. So, it's usually all those bottled up emotions that cause people, mainly teenagers, to get into such dangerous eating habits to strain themselves. So, people with eating disorders would use food to deal with uncomfortable or painful emotions. So, we need to understand the pain and the triggers and not just make assumptions. And at their core, eating disorders attempt to deal with emotional issues and involve distorted self critical attitudes about weight, food, and body image. And it's these negative thoughts and feelings that fuel the damaging behaviors.
Over time, people with an eating disorder lose the ability to see themselves objectively, and obsessions over food and weight come to dominate everything else in their lives. We need to first educate ourselves about these disorders and assure them that they are not to blame. Don't try to guilt trip the person into feeling bad about their behavior. Their road to recovery begins by identifying the underlying issues that drive the eating disorder and finding healthier ways to cope with the emotional pain that can be worked out in therapy. While you can't force a person with an eating disorder to change, you can offer your support and encourage treatment, and that can make a huge difference to your loved one's recovery.
I completely agree. Supporting them is the least we can do, and I think we should keep these points in mind so that we can be as helpful as possible. Also, how do I know if I have an eating disorder and I need inpatient treatment?
So, eating disorders are more or less characterized by the same vicious symptoms. Red flags that may indicate an eating disorder include skipping meals or making excuses for not eating, excessive focus on healthy eating, withdrawing from normal social activities, persistent worry or complaining about being fat, and talking of losing weight. Frequent checking in the mirror for perceived flaws, repeatedly eating large amounts of sweets or high fat foods, excessive exercising, expressing depression, disgust, shame, or guilt about eating habits, or eating in secret. So, if someone experiences or has noticed even two of the symptoms mentioned in themselves or someone they care about, we urge you to please look into it. You should definitely not panic, it could turn out to be nothing. But as previously mentioned, seeking professional guidance is always the safest option.
And in the worst case scenarios, anorexic patients should seek hospitalization. So if they are experiencing either an unusually low blood pressure or cardiac arrhythmia or high or low BMI, or even decreased heart rate, irregular heartbeat, chest pain, seizures due to extremely low blood sugar levels, liver dysfunction, or any of these that are associated with your mood and stress levels. And in the same manner, bulimic patients should seek hospitalization if they're experiencing dehydration, trouble swallowing foods or liquids, or are vomiting blood.
Oh, can you ever really recover from an eating disorder completely?
So, this is a really subjective question, to be honest, but it's not impossible. So, for many people, an eating disorder is like a coping mechanism against stress and other life problems. So, the foundation of every approach is to develop a healthy relationship with your food and your body, free of shame and guilt. So, while some people can leave the disorders in the past, others may not be that fortunate. When struggling with an eating disorder, the best course of action is to get professional help.
Yes, it's just about giving up unhealthy eating behaviors which have learned over a period of time. They need to stop reaching out or abandoning food as a part of the stress dealing pattern. Some tips that can help are: don't blame yourself. Having negative and self critical thoughts is a huge part of an eating disorder. Instead, just work to stay positive. Prioritize your needs. Make sure that you take care of yourself first and determine how much of yourself you can truly give to others by setting appropriate boundaries. Don't be afraid to ask for help. Be patient and kind with yourself. Recovery takes years. Many people have slips and relapses too, but you need to have faith in yourself because you can do it.
Amazing. This was a very informative session. It was great to have you guys here and get educated about these topics, especially because this is not much discussed in depth.